what are some common treatments that a child might be prescribed for asthma?
The most common treatment is a medication called albuterol. And what albuterol does is it opens up your airways. So earlier when I was talking about in asthma, you sort of have a overreaction or hyperreaction. Part of that hyperreaction is your airways that may be open to a certain diameter. When you have an asthma attack, it clamps down and constricts, so that opening is a lot smaller. So imagine if you have a pipe that would have a diameter of maybe 2 inches. When you have asthma, that overreaction or hyperreactivity causes that opening that pipe to narrow, and it may become only a half an inch or 1 inch. So now you're not able to move air as well or as effectively. So albuterol opens up that airway and allows you to breathe better. And then the other major treatment is steroids, typically inhaled steroids that you will breathe in. Occasionally, if the asthma attack is very severe, you'll take steroids by mouth and drink or take the tablets. And that affects the inflammatory process, where your body produces a lot of mucus because of the inflammatory reaction, because, again, your body's hyperreactive or overreacting to whatever that trigger is. So the two main treatment modalities are you want to open up the airways, and you'll use something like albuterol, and you want to decrease the inflammation, and you'll typically use a steroid, or there's another medicine called Singulair, which can also decrease some of the inflammation. And then depending on the severity, you will either only use albuterol if you're having an attack, or if you're having attacks very frequently, it may make more sense to, instead of waiting till you get sick and chasing it with albuterol, say, okay, you're having an asthma attack so often that I think we're better off putting you on a medication daily, which of course is no fun, but by putting you on that medication daily, now I'm going to minimize or at least significantly decrease the number of attacks and the severity of the attacks you're going to have. And a general yardstick is if you need to give your child albuterol more than twice a week, or if your child is having symptoms more than twice a week, it is probably worth at least having a discussion about getting on some type of daily medication.